My name's Rhona McMenemin. I'm a consultant clinical oncologist. I'm based at the Northern Centre for Cancer Care, which is part of the Freeman Hospital in Newcastle. I look after different types of cancer, but one of my roles is looking after patients who have testicular cancer, in particular if they need further treatment such as chemotherapy or radiotherapy. And we look after patients from all over Newcastle, but also all over the northeast, including patients from other hospitals who come to us for treatment. What tends to happen is that we are referred patients who've had a diagnosis of testicular cancer for further treatment if that's required. So probably the first thing to point out is that not everyone requires further treatment, and sometimes having the tumour removed and the testicle taken away will do that, is sufficient treatment in itself. And when that happens, we do keep an eye on patients very carefully, and they come up and see us regularly, myself and the nurse specialist, for checks and blood tests, and we can do that for quite a long period of time.
As part of your testicular cancer follow-up, you will need to have blood taken at each visit. Today I'm going to show you what's involved in this, what the needles look like, and how they will take this blood. To enable us to take blood, we need to put the tourniquet onto your arm. This is going to stop the blood flow coming down, so make the veins easier to be seen. We'll pull the tourniquet tight. This will allow us to see where the veins are, so it'll make it easier for us to insert the needle. Now we've found the vein, we need to sterilise that area so that there's no chance of infection getting into that when the skin is broken by the needle. This is the needle that we're going to use now that the skin's clean. So as you can see, it's not a very big needle and it's very thin, and it's called a butterfly. And this just goes into the vein. The needle's in place. We put the bottle into the tube, and that automatically takes the blood from your vein into the bottle. We now have the blood ready to go to the lab, which will be tested for your testicular tumour markers. All we do is release the tourniquet, releases the pressure, and I'm going to slide the needle out and just cover it with a piece of gauze. That's it. Put a bit of pressure on until the bleeding stops, and then we'll apply a small elastoplast.
Other patients do require further treatment, and in particular that's if their cancer has spread when they've been told or diagnosed that they have testicular cancer in the first place. And if the cancer has spread, sometimes we use radiation treatment, but often the treatment we use is chemotherapy treatment, and that's what we would deliver, and those are the sorts of patients that we would look after in our cancer centre. Radiotherapy is X-ray treatment, so to all intents and purposes, if you are a patient, it feels as though you're just getting an X-ray. So the important thing about that is that it's completely painless. So that's the most important thing to point out. You don't see anything, you don't feel anything. But we're using X-rays, and because the X-rays are doing a bit more than taking a picture, they're a bit stronger. You still don't feel anything, you still don't see anything, but they're actually treating the tumour. So occasionally for these types of cancers, we will treat you with some radiation treatment, but it's very straightforward to deliver. It means coming up to the cancer centre. It's pretty much always done as an outpatient, so you don't even need to be admitted to hospital, and we try and manage any side effects that the treatment might cause, and we usually manage them very well. Occasionally patients might feel a little bit sick on treatment, but we can manage that with anti-sickness drugs, but otherwise it's very simple. You come up, the radiotherapy is planned, we do that using some CT scans, and then when the radiotherapy is being delivered, you go to a special room that we keep down in the basement where the radiographers will help you, and they will plan and deliver the treatment for you. It takes about 10 or 15 minutes, and it usually is given between Mondays to Fridays, sometimes over a couple of weeks, sometimes a little bit longer, just depending on what needs to be done.
The patient will come to the treatment area, which is this unit here, We've got a linear accelerator, and this is a normal CT scanner, but it's for our verification to ensure the patients are on the right position. They'll lay down on our couch in the same position where they were scanned 2 weeks ago, and we'll set up to some permanent marks that were put on during that time. Either once a week or every day, depending on the patient's setup, they'll get a verification scan, and this is matched against the scan they had 2 weeks prior. Any adjustments in the patient position that's needed will be carried out from there. And then the treatment unit will deliver the treatment. It can take approximately maybe between 2 to 5 minutes to deliver the treatment. You can't see anything or feel anything. It's just a buzzing noise when they're laying on the bed. They are in the room on their own when they're having the treatment, but there's cameras that watch them all the time, and we're just behind a door that protects us from the radiation. So this is the treatment unit. It moves around the patient in a arc-like way. The bed will move up so the unit can get underneath as well. This is an imaging panel, so we use this to check people's positions along with the CT scanner to check the position as well. So at Newcastle we have a diagnostic CT scanner to help us with our patient verification, and the couch that's under the treatment unit can spin round 180 degrees to go into the CT scanner. Then the images will match up with the scan 2 weeks ago, and we'll carry out the moves, spin the bed back round for the treatment. Not all treatment units require one of these. Some have imaging on board, which can do the same thing as the machine moves round. It just really depends what unit you put on, but they all deliver the same treatment. So when patients come for treatment, they probably won't notice that they get any side effects for a few days, maybe up to a week and a half. As they go along the treatment, the side effects will build up. We're mainly concerned about the skin in the area. They need to look after that well and apply cream on maybe once or twice a day. Drink plenty of water because they can get a bit tired. Other than that, they might just find that they get a little bit of something called cystitis, which is agitation in the bladder, and possibly a bit of loose bowels, diarrhoea towards the end of the treatment. But we tend to monitor them weekly, and they'll be given medication from the doctor if that's required.
Chemotherapy is the other treatment that we sometimes have to use in treating these types of cancers. I think the first thing to say is that the cancers are very curable with chemotherapy, and we have a very good chance of getting rid of the cancers completely, even if the cancer has actually spread. So the chemotherapy is delivered again here in the NCCC, which is our cancer centre, and we've got 2 wards that we used and 1 ward which is particularly designated for use in patients who are called teenage and young adult patients, whom a number of these patients will fit into that category because they'll be between the ages of 18 and 24, and that's quite a nice unit to deliver the treatment in. Now this does involve coming in as an inpatient for a few days to get the chemotherapy treatment.
We're now on Ward 34 in the Cancer Centre, and this is where you will have your treatment if you're having inpatient chemotherapy. So what we would do is ask you to attend Ward 34, which is situated on level 3, but it's actually the first level up as you enter on level 2. If you attend the desk, speak to one of the nurses or the ward clerk, they will then show you to where your room is and then take some information from you and ask you some questions and let you know all about your chemotherapy. We're in the teenage and young adult room. You can use this room if you wanted to bring in anything to eat. There's facilities for you to heat food up and to keep food cool in the fridges. We also have a jukebox where you can relax, and we have games, consoles and games for you to play on during your treatment, which can help relieve some of the boredom. Most of the time while you're having your chemotherapy, you won't be feeling ill, so boredom's probably one of the worst things for you to go through. The pool table's here for your use, and you can invite members of your family or friends to have a game with you, or there may be other people on the ward who you can play along with. There's also a television here if you want to get out of the ward situation for a period of time. We have some artwork on the walls, and this is replicated into the cubicles. The cubicles are usually for our 18 to 24-year-olds who are having any kind of treatment. They consist of a bed, then ensuite, and also a bed so that one your carer or partner can stay in during your treatment.
Chemotherapy simply means drugs. Drugs of any sort, but in this context, it's drugs delivered intravenously. So what that means is that a little cannula, which is a tiny little pipe, will be put in a vein in your arm, and the drugs will be delivered through a bag of fluid into the vein, usually over 3 days, sometimes over 5 days, and that process will be repeated varying amounts of time depending on what particular schedule that you will be allocated, and the doctors decide that depending on the extent of your cancer and how much chemotherapy that we think you need.
If you're going to have a chemotherapy, regardless of which one it is, you'll need to have a cannula inserted into your arm. A cannula is a small needle that goes in that leaves a tube that they can put a drip through so that your chemotherapy drugs can be placed into this. The first thing that we need to do again is to apply a tourniquet, the same as when you were having the blood taken. This is tightened so that we can see the veins. To prevent any infection, we need to clean it with an alcohol wipe. First of all, we'll show you the cannula. This is the needle, but when it's placed into the arm, the needle is taken out and it leaves a small plastic tube. We put the needle into this vein, slides in, and then we would take the needle out. Release the tourniquet, put the dressing on to keep it secure. The needle that's now in your arm has been removed, and in the arm is a small plastic tube, quite flexible, that the fluid and the chemotherapy will go through. Now we have a bag of fluid which we're going to attach to the cannula. So remove the needle, it screws onto the cannula, and that's it, ready to go.
So chemotherapy can cause side effects. The most important one is that your blood count can drop during chemotherapy, and if that happens and you feel poorly, we always tell you to come to the hospital to be looked after, because if you don't have white cells in your blood to fight infection, then you can become very poorly indeed, and it's important that you're in hospital so that we can look after you. Otherwise, the side effects are that you'll lose your hair, but it does come back, and that's only a temporary thing. And sometimes when it does come back, it can look a little bit different. Straight hair sometimes becomes curly hair and vice versa, so maybe that's a good thing, you never know. And the other things it can cause are, it can sometimes upset your kidney function, but that's something that we look after as your doctors, and we monitor your fluids and your blood tests to make sure all of that is okay. And any sickness or vomiting, which I think people do get frightened about in terms of getting chemotherapy, we can usually manage to avoid that very well nowadays with the anti-sickness tablets and drugs that we can give you. In terms of how we look after you when you're getting your chemotherapy, because you're an inpatient, we'll see you very regularly, and that time tends to be on a Wednesday morning when we do what we call our team ward round. So that's myself and the other doctors who also look after patients with this sort of cancer, go round the ward and visit all our inpatients. And that's quite good because you get to know the other doctors on the team who might look after you if your own doctor's going to be away. So we see you every week. week. We'll see you any other time on the ward if there's any problem. The other thing is that once your treatment has been completed, you'll get scans at the end of your treatment, and then you'll come back and see us in the outpatient department to talk about your scans and see whether or not any extra treatment is required after chemotherapy, because very occasionally you might need another operation to take away any areas of scarring tissue usually that's left behind. We obviously aim to deliver care to everybody as an individual, regardless of who they are, but we've got things like the teenage and young adult unit, which has got things like the patients have got their own kitchen and a games room, which the patients get a lot out of using. We have 4 bedded rooms and individual televisions beside them so that patients can watch the TV. There's internet access. If patients need someone to come and look after them, in addition to us looking after them, their carers or other members of their family, we've got single rooms, we've got sofa beds that family members can use as well. So we're very able and willing to be adaptive to anybody who needs any extra support. I said earlier on, and I think the first thing to emphasise is that these are very curable cancers, which is obviously a very good thing, and the vast majority of our patients are cured of their cancer, particularly if they don't need chemotherapy, and even if they do. The second thing is these are very rare cancers, so although often patients will perhaps notice there's a lump in their testicle, the vast majority of these do not turn out to be cancer. But equally, it's very important that if you notice something in your body that's not quite right, and you notice a lump or a swelling in your testicle, that you go and see your GP and that you get it checked out. 90% of the time it will be nothing. It will be a little cyst, which is just a fluid type swelling. It won't be anything other than that. An ultrasound test, which your GP will organise, will tell us exactly what it is, and if it does turn out to be something that needs more attention, and it turns out, for example, to be a testicular cancer, then again the most important thing is that it can be cured. You might not even need any additional treatment like chemotherapy, and if you do need chemotherapy, again the chances of getting rid of it completely for you are excellent.
I'm Craig Carr. I was diagnosed cancer 2 years ago. When they first tell you, you go into shock and you go into major denial. So like, it can't happen to me, it happens to somebody else. I feel the family found it a lot harder than me to deal with me having cancer. I did all the treatment and I've come out the other side. Basically, testicular cancer, normally the treatment is you get chemo for so long, then you get washed out, then it's chemo again, then you get washed out, and chemo again, and you get washed out. It's constantly like for about 3 or 4 days. You have to keep a positive attitude. And it's hard to say that. I've had a few good friends with a positive attitude and they've got through. With testicular cancer, it's probably one of the best curable cancers. 9 times out of 10, they find it in middle age, and most people are fit anyway that to fight it. Because like, I've bumped into 3 people on the wards, on ward 34, and they had what I've got. And like, they're all about my age. And they're all like fit adults. You can fight it better. If you have to have a cancer, this is the cancer to have. Our cancer is curable. Take one day at a time and you'll win.